I've spent the last few years working for one of the largest shockwave clinics in North America, and I've learned a thing or two about the power and untapped potential of regenerative medicine. But the march towards a future where sickness is healed from its root cause is challenged by the influence of big pharma and their deep pockets. So now we're forced to answer questions like, how do we get rid of joint pain, take back our performance in the bedroom, and heal diseases from the inside out without band-aid medications or negative side effects? This show will give you the answers. Follow along as I interview the world's top experts and doctors and how they transform their lives and their patients' lives using the newest advances in biotechnology. I'm your host, Austin James Wolf, and you're listening to Modern Biotech Radio. Hey, what's up, modern biotech pioneers? So a lot of people have been asking, what are exosomes? What the hell are they? What do they do? There's been a lot of talk about exosomes and how they look like viruses. There's some conspiracy theorists out there that think that COVID-19 looks like an exosome. And frankly, a lot of people just don't know how exosomes work. And so we're here to dispel all those myths and actually explain to you how exosomes work. But honestly, if you're listening to this and you don't quite know how exosomes work, you've heard about them, you heard rumblings about how they can suppress tumors, cure paralysis, cure Alzheimer's, cure stroke, sexual dysfunction, joint pain, hair growth, all that good stuff. You've probably heard rumblings about that, but you don't quite understand how it works. That's totally fine. It took me, honestly, a year to understand how it worked until I saw this great metaphor watching a coronavirus video. So what I wanted to do was sort of explain to you what exosomes actually are, but I wanted to do it in a unique way. So, of course, I work with the Novus Center, and we actually are the largest shockwave provider for sexual performance in North America. So we do more shockwave treatments for treatment of erectile dysfunction, Peyronie's disease, and just sexual performance for those biohackers out there, more than anyone else on the continent, right? But in doing so, we started to introduce stem cell therapy into our practice for stem cell P shots, which can help grow even more blood vessels and help with sexual performance. But then we learned about exosomes, and we read the clinical studies, and we introduced exosomes into our practice, and we just got such better results with exosomes. It was just unreal. So we stopped doing stem cells altogether, and now we only do exosomes for exosome P shots, for joint pain, and some other things like lung regeneration for those with weak lungs, a little bit of hair growth too. So we use exosomes for a lot, but a lot of people just still don't know how exosomes actually work. And if you Google how do exosomes work, nothing really good comes up. I mean, there's a few explainer videos, but they're still a little hard for people like me to understand, right? I'm not an MD. All I do is read clinical studies. So that's sort of where my knowledge is coming from, is from the clinical studies themselves. And so what I wanted to do was sort of take that knowledge that we know from the clinical studies and explain it to you in Austin terms, which I call layman's terms. I don't like calling people layman, but I try to simplify it. So what we're going to do is we're actually going to animate a video on basically animating a very simple to easy to understand video on how to do it. And the way that I was able to come up with this metaphor that we're going to explain is I saw a video explaining how the coronavirus works, and it showed a little bubble with its little RNA, its little code inside of it, attaching to a cell and injecting its code into the cell. And that's kind of how exosomes work. And then it occurred to me, I'm like, oh man, these work essentially the same thing, but the difference is in the code inside of the microvesicle, the microvesicle being a virus or an exosome. So what we're doing is we're making this animated video, and I had to write the script for it. So in fact, you're going to be able to make this video with me, and I'm going to read the script to you right now, sort of testing the water, see if the script makes sense, and hopefully you'll be able to see this script come to life in the next month or two as we make the animation. So here it goes. Hope you enjoy. Okay, so we begin. What are exosomes? Why is the media obsessed with them at the moment? Why do they look like viruses? How do they work? And are they really better than stem cell therapy? These are the questions the Novus Center will answer. First off, what is an exosome? An exosome is a bubble of microRNA that is secreted from cells. Now, what does that actually mean? Think of an exosome like a USB stick full of code. This is how a cell can tell another cell what to do. They send their exosome, their USB stick, into another cell. And that exosome, or USB stick, injects microRNA, or its code, into the cell and programs the cell to do something. The code inside of the exosome depends on the source it came from. Stem cell exosomes are regenerative in nature, and their exosomes are coded to reprogram cells in the environment to do very good things, such as decrease inflammation, regenerate tissue, or kill off senescent cells, also known as zombie cells. Zombie or senescent cells can be very harmful and have been linked to cancer, but that's a video we'll save for another time. On the other end of the spectrum, exosomes can also be secreted by cancer cells. These tumorous exosomes can do very harmful things as well. As you can see, exosomes are neither good nor bad. Just like cells, there are good regenerative exosomes and there are bad harmful exosomes. The difference lies in the microRNA or the code inside of the microvesicle. Exosomes from stem cells will have very good code inside of them, while exosomes from cancer cells will have very bad code inside of them. You follow along so far? We know it's a lot, but we're almost done. At the time of making this video, a lot of talk has surrounded viruses and exosomes, especially since exosomes look like COVID-19 or coronavirus. The fact is, exosomes and viruses are very similar in size and act very similar as well. They both act like USB sticks that inject their code, their microRNA, into the cell. But with viruses, typically the code is very malicious. Imagine picking up a random USB stick you found on the street and plugging it into your computer. If that USB stick contained a virus, it could infect your entire computer. Now, if we're talking about the human body, typically the virus will replicate itself and do very, very bad things. But as far as similarities between exosomes and viruses, that's about it. Remember, exosomes are just microvesicles, which are basically just little bubbles of microRNA. And the code they inject into your cells typically depends on their source. Clinics like ours, the Novus Center, use stem cell exosomes to aid in the regrowth of cartilage to relieve joint pain, help foster regrowth of hair follicles, help regenerate lung tissue, and help increase sexual performance in men. Typically, there's little to no negative side effects, and the results are much more noticeable than if we just used mesenchymal stem cells alone. If you'd like to know if stem cell exosomes can help relieve you of joint pain, improve sexual performance, or just help reverse the effects of aging, please visit thenovuscenter.com and a friendly specialist can help you out. If you have any questions or would like to see another video explaining something else, please let us know in the comments. Thank you for watching and supporting another video made by the Novus Center. And then below I have some description references that'll go into the actual study themselves, and those have some clinical studies that link out explaining what stem cell exosomes are. So there you have it, guys. I hope you enjoyed this behind the scenes look of how we actually make our videos, our animation videos. I read you the script, and now you understand the difference between exosomes and viruses, or at least I hope you do. If you're still a little confused about what the difference is between exosomes and viruses, it all depends on what is inside of the microvesicle. What is that microRNA? What's the code? If it's very malicious code, if it's malware, that's a virus. That's very bad. And then exosomes have their own sort of tier. So cancer cells can secrete exosomes. It's very bad USB sticks. Stem cells can secrete stem cell exosomes. Those are very good USB sticks. So again, it all depends on the actual code inside of the microvesicle. That's the difference. But in our clinic, like the Novus Center, we use stem cell exosomes. So those exosomes come from mesenchymal stem cells, and they have regenerative properties. So they do a lot of wonderful things for our body. So again, if you want to learn more, just go to the Novus Center. And that's it, guys. Thanks for watching.
You and I are slowly dying as we age, but that's common knowledge. What isn't common knowledge is that you can actually reverse the damage that aging has done to you. We develop joint pain, hair loss, lung problems, but many of our patients have actually reversed these problems using the latest breakthroughs in biotechnology. If you'd like to know what biotech we're using on ourselves, our families, and our patients, and how you can use it to transform your body and change your life, just go to modernbiotechradio.com. Now, you might be thinking, does this stuff actually work? Well, it does not work for everybody. So if you'd like to learn if this could work for you, just go to modernbiotechradio.com. You might also be thinking, if this works so well, why hasn't my doctor told me about it? That's a good question, and the answer is a bit complicated. Maybe they're too busy helping patients to keep up with the newest clinical studies and advances in medicine and biotech. Or maybe they just haven't started doing it yet but want to. Back in the day, we didn't know about these advances, but once we learned about them, we read the clinical studies and started doing it in our own practice. Once our patients started getting results unlike anything we've ever seen before, we never looked back. So, if you'd like to learn the latest advances in biotechnology and how you can use it to reverse aging and feel young again, just go to modernbiotechradio.com. You can learn all about these advances and even join our private community full of others that love biotech. Oh yeah, this is completely free, no strings attached. All you have to do is just go to modernbiotechradio.com. I'll see you there.